Can I firstly welcome everybody? For those that don't know, my name's Heather Cluett. I'm the chair of the forum. Oh, and I'm the vice chair. And do grab a drink and stuff. And as Marcus just said, we are trialling this hybrid tonight. And there will be a recording which hopefully will be available on the council's YouTube channel. And then if this works okay, we're hoping to do more hybrid meetings, but to include the ability to actually log in from home as well as physically be here. So that's all for the future. We're very much looking forward to hearing our speakers this evening. And obviously having any questions, suggestions, comments from all of you as well. So that will be good. There are some signing in sheets on the tables. If you could make sure that you sign in, please, and then you will get all the information sent out to you subsequently. Mark. We've received a few apologies. One is David Gillard of Westway Farm, then David Boardman, who's part of the road safety team of BEMS. And we also received apologies from Emma Wetherill from West Hertfordshire Parish Council. So, for our first and double first, I think we're welcoming Jackie Head, who's going to update on the X91 and 99 bus service.
Okay, so
yeah, we can see it. Yeah.
Yeah, this is what I'm talking about. So I want to give a very brief update. It's quite a crucial moment in time for these West Local buses, and I'll talk about why more in a minute, but these are the kind of issues that I'm going to quickly look at. I know people want to know what happened for that great big bus survey, what were the outcomes, to talk a bit about the changes in the routes and the challenges, of which there are significant ones, and what you can do next to help support these routes to continue. So to start with the Great Big Bus Survey results, this will be circulated afterwards, so you can click into that link and see more detail if you want it. But the main sort of things we found interesting about it, one was about how high the satisfaction ratings are. They're higher than other fixed term services nearby. They're much higher than Westlink, and that was gratifying, but also a bit surprising in a way. In terms of what in particular people valued, the X91 is really valued for the speed into Bristol, and people also talked a bit about cost, convenience, decarbonisation benefit and social value. And what came out of the survey was that they wanted that route to be more frequent and enhanced. The 99 in terms of the survey showed really high social value. So there was a lot of information from people about how it was a lifeline to them. And I would encourage you to look at that survey, and on every page we put a quote, and many of them are about the social value of the 99. But the criticism was that it was too complicated, the figure of 8 was difficult to understand, and it wasn't frequent enough. And the overall kind of feeling for both routes was that this was more than just a bus route, that actually this was facilitating a kind of community building, and that was partly the friendly community on board the buses, but also through our kind of efforts in our membership scheme, our Facebook group, Instagram, connection with parish councils, etc. So we've responded in various ways to those findings. I mean, the main thing we've tried to do is amplify the messages of the report, and within that to find out a bit more about how Westlink is performing in the area. And that's an interesting one, actually. I'm not going to talk about it this evening, but except to say that in terms of WECA generally, Chew Valley is one of the most used areas for Westlink, which may come as a surprise to some people here this evening. There are the significant use of it is getting children to Chew Valley School from South Bristol. That's where it's really significantly used, regularly used, and it functions, it works because it's collecting a number of children from the same place every morning and taking them to the same place every day. And Westlink has kind of recognised the algorithm of that and therefore is providing that. But otherwise, across the region and across the Chew Valley, I should say, Westlink is really not functioning very effectively and not very widely used, anecdotally, because people can't get lifts. So yeah, we did a bit of exploring to find that out. In terms of the X91, in September we added a Saturday route and also a Saturday evening service, and I'm pleased to say that has already been really popular. And the frequency of the service has gone from 3 times a day to 4 times a day. And really, since it began, the X91 has just grown and grown exponentially. There's 3 times as many people on board as there were when we started it 18 months ago. So that's a real kind of success story. More needs to happen, but there's a lot happening in that route. With the 99, in September, we changed from the figure of 8 to a loop route. There have been issues with that were kind of unforeseen things that came up from that change, and so we are back on the negotiating table again, trying to make a further change to simplify the 99 even further. That's not something I can talk about in detail now, but just so you know, we are working on it. And the other thing that we've significantly done is put a lot of energy into our comms for both buses. So we had an event in September by the lake, and then we've launched the Better by Bus campaign, where we've done a number of different activities where people can get freebies if they go to certain places using the bus, and in particular the Saturday night Bus Bites events. And just to give a plug for that, this Saturday is the last of the November Bus Bites events. If you go to Compton Martin Ring of Bells and you go there on a bus, X91 or the 99 will get you there, then you get a free snack board with whatever drink you order. Challenges, there are many. So I actually want to begin at the bottom of this list, which is the biggest challenge is the funding cliff edge in March 2026. So our funding, the West Local grant, runs out then at the end of March 2026. And we are lobbying like crazy to get an alternative source of funding, but there isn't anything that has yet been agreed or allocated, and there's no certainty that anything will be. So it's quite a possibility that these routes will end in March. And part of what's challenging about that is, in order for a service to run from April the 1st, it needs to be registered on January the 22nd. So it's a very concertinaed timetable at that end. The other challenge is that WECA, well, they may know now, but the last time we spoke to them, they hadn't been told how much bus grant they were getting from the government. Originally, they thought they were going to find out in the summer, then it became the autumn, and most recently they said November. Well, we're very near the end of November and we haven't heard any news that they know, but maybe they do now. But that makes it very difficult. They've got to try and decide which routes they're going to fund, how they're going to keep routes going, whether there are some they need to stop. And they're gathering evidence, and they've taken very detailed stats of September and October this year, and they will be taking detailed stats of November. So the biggest impact you can have is get on a bus before the end of November, help us show really good numbers. Going up from the bottom, the routes are primarily assessed on their cost per passenger, and their social impact is also assessed through concessionary card use. One of the problems we have is that the ticketer machine, which records these things, has been not working effectively, particularly on the 99. We think there are issues with tracking in a very rural area. We're not sure. We're trying to get to the bottom of it, but we did research to prove how much is not being tracked, which is what's detailed here, the shortfall. Sometimes the issue is that the ticketer's not capturing the data, and sometimes actually there's not a machine on board because if a bus breaks down or there's an issue with a bus, sometimes another bus has to be sent that doesn't necessarily have that facility to have a ticketer on board. So it's probably a combination of those two things. So what we're doing about these issues is we're supporting, and also we're holding to account the Big Lemon, who are the providers, to provide data and to be on top of these issues and to seek to not send buses out without ticketer machines on. And, you know, they've been doing driver training as well to make sure there's no driver error. We've highlighted the data issue to WECA. We spoke to BEMS. We spoke at a BEMS meeting, and we also spoke at a WECA meeting. And we've done a very detailed analysis which shows how much data is missing. We also put forward at the last BEMS full council 9 criteria that we were suggesting for how you might evaluate routes in ways other than cost per passenger. So if you want to look on the BEMS website, you can see that, or I can pass it on to people later. What you could do, and it's a tiny window, you need to get your pens out or your emails out quick, is write to BEMS, write to WECA, say how much you value these routes, assuming you do, say what impact they have in your community, say what it would be like if we were without any routes in the Chew Valley from April. We're meeting, in fact, tomorrow with people from BEMS and WECA to try and discuss this further. You can use the buses. I said it before, there's nothing better than that, actually. Just get on board, and you can encourage others to use them too. Yeah, and use it or lose it. That's never been more true than right now. Just to pull towards the positive again, we as a group do have a bit of a future vision for what we would like buses to be like in the area. We would like there to be 12 on a bus at any one time. That's the average. Now, we do get large numbers on the X91 first thing in the morning, but that's not enough to make up for there being fewer than 12 at other times. And the 99 is struggling to have that kind of number on board. Sometimes we do with the school run, not always. So we need to build to that. And to get to that, it's not about a few people doing it a lot. It's about a lot of people doing it a little. So challenge yourself, you know, could you make that journey on a bus? And we want to get across the idea, we want to try and instill the culture of people using buses as their first choice. They try the bus. If they can't do it by the bus, they have to do it another way, but they think of that as their first option. We'd like to see people more routinely thinking about their travel to work, to education, to training, to shopping, to leisure, and think about bus first. And in terms of the X91, one of the issues is that there's more people going into Bristol than coming out from Bristol. So we'd like to encourage more people to come out from Bristol, both for jobs in the Chew Valley or for leisure, or as tourists coming out as well, so that the valley can benefit from that tourist pound, and businesses can benefit from a richer pool of places to get their workers from. At the moment, the X91 is an electric bus, which is delightful, and that's been the case since September. It was introduced from last March, but we would like to see an increased use of electric buses as we go forward. That's where the real decarbonisation benefit happens. And we're looking into other potential new routes. So we've already suggested the idea of an X91 style route to Bath, which would go in a kind of direct line, much as the X91 does into Bristol, and would take people to the Park and Ride, but also to the RUH going forward. So yeah, key message again, get on board. Thank you.
That's great. Thank you very much, Jackie. I think use it or lose it. I hear that so many times about different things.
Yeah.
But that's great. I think if anybody's got questions that they want to sort of steer towards Jackie, if you could just, there are some post-its and things around. If you could just jot that down or a post-it and let Mark have it, and then we'll get it through to Jackie and get responses. Okay, thanks very much, Jackie.
Are you happy for me to leave now and those responses to be sent to me in a written way?
Mark will get those to you. Yeah, that'll be fine.
Lovely.
Yeah, we'll
Okay.
connect you up at the end, Jackie. Okay,
Great.
great.
Thanks
so
very
much.
Thank you.
Thank you for being number one. Now I'm handing over to Lynn, who is going to talk to us about the resilience day. And I think one or two other people were on it as well. So
Might chip in, I think.
they might chip in.
Okay. Chip in if you will. Yes, I just wanted to run through that Resilience Day because it was a really important session for us to have every year. Run by BEMS, and it's not just about flooding, it's about all kinds of resilience. So the morning was various speakers. First one was talking about BT digitalising telephones. Is that right? Or digitising, should it be? Anyway, doing that to telephones and how we could get involved with that. And the really good news is that you don't have to have a BT line in order to have this done. And if you're over 75, yippee, it's free. So but now all the detail of it, Mark is going to send you a link for. So I'm not required to go into detail, which I probably couldn't, but I know it's got to do with batteries. Okay. The next person talked about how BEMS were mitigating climate change, and that was really interesting too. And looking at, you know, building and how they're trying to keep down the whole issue of things that make climate change or climate not change, adding into that, and that was very useful. The other one was from the emergency coordinator in Bristol, who talked to us about evacuating people. And we've got a rest centre in Chumagna, and for me it was really interesting because I thought we'd done pretty well. But what she focused on was how people feel when they are evacuated, and you know what a shock it is, and what a range of things you need to have. And you know, particularly if you've got children, you need to have some games to distract them, and them coming into an unfamiliar environment and so on. So that was really helpful. And one thing I've taken away, I mean, more things as well, but we've got biscuits and cups of coffee and tea available. But I thought I'd get a toaster, because a toast is sort of a friendly smell, isn't it? And more comforting. And then the last one was Joe from the Environment Agency, who took us through the alerts and warning system and reminded us that alerts only happen in certain times of the day and I'll cover a big area, whereas warnings you can get anytime. And they're trying to make their alerts and warnings more timely, really, so that we've got time to do things before it gets dark and before we're absolutely inundated. So that was very helpful as well. Then we had 2 workshops, one of which was looking at planning, doing emergency planning. And BEMS have got a really good template to use for planning. So that's always for emergency planning, which is really useful. And Alex has been doing ours. It's taken quite a long time, but it's coming. And then the other thing was EVAC. I don't know if you've heard of them, but there's the voluntary group EVAC. That's what I said. EVAC. The EVAG. Yes, they're the voluntary group from the Somerset Levels, and they formed through the Rotary. They formed after their dreadful times, and they will issue different equipment to houses. So if you want them to come and speak to you at your home, rather than doing it on a parish level, they do it on an individual level, and they'll come and see what you need. It's not things like boards and pumps, but it's more the smaller things, like things that you can put in your toilet to stop that overflowing, air brick covers and things like that. And they don't really make a charge. You pay what you can. So they're well worth keeping an eye on. I thought that was a really helpful vote. So yes, it was really helpful. And that was the most of it. I have to say that these things, they are all lovely, the things you go to. But the joy for me is to be able to meet people from the Environment Agency, from BEMS. Dan Parr was there, our principal engineer, you know, and you can have those side chats going on as well, which is so useful. And I think, you know, it's such a helpful thing to have that kind of a day. And then lunch was superb. Okay, I'm now introducing Alex, who might be known to you as a community first responder. Yeah?
Yes.
And he's going to be taking on the role of community training volunteer. And so he's going to tell you a bit about that. Yeah?
Okay, yes. Where do I stand for this?
Yeah.
That's thank you. Yes, I've been a community first responder within the Chew Valley for the last 9 years. Around about 1,000, just short of 1,000 call outs, mainly in the Chew Valley, but also South Bristol. I'm now taking on a community role in training people within the valleys. Now, the purpose of this is that we've got a really good service coming down from the government to BEMS to ourselves. But what the government paper, the recent government paper was saying, that you really have to build it up as well from the bottom up. And unlike most government things, we hope they'll actually join, but that might not be wishful thinking. So what I'm proposing is sort of threefold. Firstly, to increase the awareness and the ability to do CPR. You know, the things that you pump to when there's been a cardiac arrest. Increase that throughout the valley. The more you get, higher the number of people that will not just survive a cardiac arrest, but also survive it with a good quality resuscitation. And we can do that through parish councils, through local voluntary community groups, faith groups as well, by trying to access enough people so that this becomes a sort of critical mass. The other thing I plan on doing is I'm a Good Sam first responder. I don't know if you've heard of that. What happens is that 999 call goes to ambulance service. Good Sam hacks into that and activates their own people in the locality, normally within about a kilometre of the event. That's good quality, trained CPR being delivered within a few minutes. These few minutes are absolutely vital. If you go 10 minutes without CPR, there's no point in trying. If you go 6 or 7 minutes, your quality of the recovery is going to be much reduced with a neurological deficit coming up. So the fastest we can get this, the better. And thirdly, I'd like to help appoint other community first responders like I was within the area. They are equipped, fully equipped ambulance service responders, trained to do the initial stages of a first response before the ambulance gets in. And the third thing I'd like to do is to run things again throughout the valley in order to increase awareness of the kind of medical conditions that arise through emergencies. For example, hypothermia, heat-related illnesses, even dehydration, even hypoglycemia. Also, all these kinds of things that if you know what to do, if it's not gone too far, you can sort it out at home. But if you also know when you should be calling the 111 or 999 or the local surgery, what you should be doing in these cases there, how bad is, in other words, how bad has it got? So the more people know about that, the less we overload the ambulance service, the better the recovery with fast response, somebody on site in the same household being able to do something for the patient. So that's what I'm aiming to do over the next year or two, build up that kind of community resilience relating to health issues. Have I done my 5 minutes?
I think you
Can I waffle a bit
we
more?
were in 5 minutes.
Okay.
Thank you, Alex.
Alex, you got a question?
Just when you say that, what geography do you mean? You mean all of the parishes covered by the Chew Valley?
Yes.
Yeah.
Yes. What I hope to be doing is contacting parish councils, also be put in touch by the parish councils into local groups, maybe arms round groups or scouts or whatever, to do responding. We'll be given equipment to do all this by the ambulance service. We'll be given support by the ambulance service to do it. And we will have people who are genuinely experienced. I've been to 46 cardiac arrests over that time. So I know what cardiac arrest is like, and I know how to do it as well as possible. Okay?
Actually, in your system, I'm obviously a qualified first aid instructor.
Oh, good.
Constabulary, so if you need a hand.
Yes, yes. Oh, yeah. We'll do. That would be splendid. But already we've started to build this
Network.
building system.
I love it.
Alex, if you send me your presentation, I'll make sure it goes out with the notes after the meeting.
Okay, we'll do.
Thank you very much, Alex. That's really good. Okay, I think we're back onto a link with Nigel O'Keefe from the Avon Fire and Rescue Service.
Doesn't look like he's been able to make it. They did say they were
Okay,
on
I
call.
didn't think they were So we haven't got Nigel.
We haven't got Nigel,
Okay.
unfortunately, but we'll follow up with him to see if he's got an update that we can provide.
Through the fire brigade. Little inter-rivalry.
Well, that's very appropriate, Rob. Thank you. We're over to you now for your 15 minutes.
Don't boo.
Come on down.
Oh, right, let's that. All right, fair
You want to sit here?
Okay. Evening, folks. Some good news moving forward. So, with regards to what's going on around the speeding and everything else, we are making some good progress. My further movement in relation, obviously, I'm talking about the ASB and the bikes and everything that's gone on out on the 3114. But I'm now looking to take some impact statements. So I don't see Chris. Laura?
No, not here. I'm here though.
Yeah, Laura and Chris are going to be my go-to. I think if you're happy, I'll take a couple of impact statements from you and Chris.
Yeah.
That basically outline the pressures and everything else that's gone on over that period of time. I will then be writing the impact statement on behalf of the constabulary to basically evidence the rise over the 18-month period since I've become the sergeant in the area, and that will then be fed back in hopefully sometime early in the new year to BEMS as a whole when we're looking towards getting this PSPO. Some of you would have been on the meeting that we had last month. There's not a massive deal of movement forward. I believe things have dropped off a little bit in relation to the bikes and everything. We're still monitoring Facebook groups and various other sort of things in relation to when they're doing car meets and things. So, for example, there's one tonight where they're complete Cheddar down to Weston-super-Mare and then driving up the M5 to Gloucester. So I was clearly all over that page this afternoon, just having a look to make sure Shoe Valley wasn't mentioned in any way, shape or form in the comments, because had it been, I'd have had people out here. I'm aware of the rave. I can only apologise. The thing is, it's identifying locations. So for us, sadly, it's now going to be part of an intelligence package moving forward, that when they say where are likely raves going to be, we will be saying, right, well, there was a rave last time out at Shoe Valley. That location needs to be spotted. But there are people within the community that set these up that are always hunting for locations. So if you, even in the early stages, see sort of 5, 6, 7 cars going down a dark lane, you know, middle of the day, starting to scope things out, let us know early, especially if it's over a bank holiday. The most likely times for raves are a Friday and a Saturday on a bank holiday, sometimes even on a Sunday, because people aren't going back to work on the Monday. So if you see anything sort of suspicious in accumulation, especially of cars, because the majority of people will drive there, and then you'll start to see just the roads start to pile up. That's a sure indication. But yeah, like we were chatting, I can only apologise. It's just one of those things where we're looking for locations and then they are. I'm sure it is. Oh yeah, I'm calling you out. Honestly, they're calling you out. So we had that meeting. Going back to the bikes, obviously, we are still discussing double white lines, central islands. What we don't want to do is move the problem from 3114 round onto, is it Perrots or Herrots Bridge? Herrots. I always forget the names, but we don't want it to just move around. So anything we're thinking of doing on the 3114, we are considering budgets to look at doing on Herrots Bridge as well, to make sure that we're trying to double off They're looking at putting a crossing in between where the ice cream man is on Heriot's Bridge and the pavement on the other side. I think they're looking at extending the pavements as well. And I can't remember what one of my colleagues said when you did them. But I think there's a big project on the way in regards to cycle paths. And I get some people like it or dislike cycle paths, but the work being done will sort of help with pedestrianising the sides of the roads and helping us out with that. So there is stuff in the pipeline separate from the things we're talking about. I finally, early in the new year, news to Martin as well, looking at getting the staff trained on speed guns. So by the time next sort of spring comes round, all my staff should be trained up. Before anybody asked about staff, I have finally a new officer starting on Sunday with the team who is going to be the Chew Valley beat manager again. I've been operating for the last 2 months on my own, so I'm not going to sit here and deny it. I've had no Keynsham PCs and I've had no Chew Valley PCs. The hard work done by Sarah, Martin and Rebecca over that time has been a godsend to me. They've been fantastic. And yeah, you know, I won't hide that. My only other officer has been off sick with stress because he's been the only officer working and his crime rate has gone up. I'm not going to sit here, you know, I'm being recorded. You know, my stress levels are through the roof as well at the moment. So I'm looking forward to getting a new member of staff coming on Sunday. The officer who's off sick returns on Tuesday, and I'm expecting a third officer sometime in mid-December. So we'll be back up to 3. Then an officer leaves in January with a third again replacing him early in February. So by February, I should have 3 PCs, 3 PCSOs with a 4th PCSO potentially on the radar to join. So things are going in a positive direction policing wise. Please bear with me. I know I do my damnedest to be responsive to everything that everybody sends to me. The other thing I always encourage, if you can come to the solutions meetings, which I know some of you have, please come along so that we can have conversations. I think the next one I sent an email out was the 7th of January, 6th of January. Has anybody got that email?
Yeah.
I think it's 7th at 10 a.m. Yeah. So I figured I'd give it sort of 6 weeks after this one and let's get through Christmas. And then I'm guessing after that, it'd be about 6 weeks to the next forum, etc. on rotation. So it's a nice little in between for us all to keep up together. Other than that, and obviously I'd like to learn about with the paid stuff. Any questions? There's always questions for me. Come on. I like being recorded. I mean, yes, sir. How can I help?
First of all, obviously I did attend the update.
You did.
Meeting and really positive from Chief State Parish Council in terms of all the effort that's going in, things that are happening. So highly appreciated of that. I say that up front. Just for clarity, when you say you're getting obviously impact statement from Laura and Chris, what's the purpose of that? What happens to that?
It helps to go towards the evidence for the PSPO. So obviously other people have called, but how we will introduce that evidence is via the logs that are called in with Laura and Chris, obviously both living pretty much on the direct vicinity of that location. And no disrespect, Laura, the amount of calls put in, they are the 2 people I feel have been most impacted during this period. And evidentially they're the, you know, without wishing to be rude to anybody else, they're the best people to produce that evidence because of the cause. And then myself as the sergeant, I'll sort of do what's called a community impact statement, whereby I just take the full 18-month period and I can show the statistics and everything. We are being helped by a South Gloucestershire member of the council who has got a PSPO in South Glos set up. So there's a gentleman by the name of Bobby Ewley who is helping us move ours forward, and he's quite confident that yes, we will be able to sort of get one on our before spring. So
And the second part was at that meeting that we had, I was very complimentary to the headmaster. I think
Gareth's not here.
About the parking and stuff and outside the school, and then since I said that, it's just been awful.
It is.
And even tonight, I walked here tonight, and everybody is parked on the double yellow lines, and the area where there's no double lines, no one's parked. And today I walked along.
At the front.
Yeah, yeah.
There's a rugby- there's a
Today I
rugby
walked
game or
along
something.
at school emptying time,
Mhm.
and they were even parked on the yellow zigzag line. So can we do anything to try and
I can get back. to
start
Gareth.
enforcing it?
As we discussed, Gareth is quite positive to assist, as you saw in
Yeah.
the meeting. Obviously, I did say to him afterwards, because we did have a further sort of conversation afterwards. He's going to become quite effective over something that he is working quite hard with
Yeah,
the local
ultimately you haven't
parents.
got control over where
And it's
parents are.
difficult, no, but he does get the support as best as he can. The enforcement side of things, the issue I have, not with enforcement, is I could go down there. Let's, prime example, we're back on Monday, so I could ask Martin, Sarah, Rebecca, and the new officer to go down and put 100 tickets on every single car that parks there. If I don't do that every day, it will continue. And it's the same with every school in every area, in every sort of beat area I've ever worked in. It does have to be sort of a joint effort that I'll have to have a chat with Gareth about, and I will take it away. You know me. I'm
Yeah, we'll
quite-
support too, and we have conversations with it. I
Um,
just think, we just think as a parish council, if people just park on the double yellow lines and nothing happens, I
Double
get
yellows
that
aren't-
they're
double yellows aren't
just
police.
doing some
Yeah.
tickets, I think, but at the moment, nothing seems to happen, so people just think, well, it doesn't really matter, we can ignore these.
And that's the difficulty, because the policing powers is for what we call an unnecessary obstruction. And double yellow lines would be more of a council
Yeah.
matter, so.
We can try and follow that up, and also I've seen different people in Bristol with companies that will, things don't park in the.
Yeah.
Dave Boardman and his apologies, Mark.
Yeah.
Dave Boardman, he picked the right night to give his apologies, didn't he? So
Yeah.
I'll chase it up with Dave though as well, because
Unless they block the one lane.
yeah, what I also
I mean,
don't
they are
want,
blocking the pavement now, because the other thing, I had to go out into the thing. It's not illegal to park on the pavement.
Okay, so we need to take away the fact that the council need to be engaged with this, and that's Dave Boardman.
it is, you can't drive onto a footpath. The law basically states.
Highway code says it specifically.
Sorry?
The highway code says it specifically.
Yeah, I mean, I can bet, so me and Martin were chatting the other day, the lovely Mr. Hale, from Hampton sent in a message saying people were parking. But when you don't find anybody with the vehicle, the other offence is driving on a footpath, because there is only one way a person has put that car there. And that is by, it's not like they got out the car and pushed it, and, you know, to avoid that part of legislation. The fact is that they have driven their car 2 wheels up onto the footpath, therefore an offence is committed. Now, again, I don't want to get into the realms of every single person that puts 2 wheels onto the footpath, because let's be honest, you then create an atmosphere. You know, what happens is, unfortunately, social media becomes a look what's happening, looks what happened, looks like. But then the other side of that becomes, well, if they're doing that in Chewstoke, why aren't they doing that in High Littleton? Why aren't they doing it in the Hartrees? Why aren't they doing it? And then all of a sudden, I individually will be creating a bit of an issue for my colleagues in all the other policing areas. So I'll always start off with trying to remedy it with conversations, working with council, as you rightly point out, Anna, liaising with Gareth. And then if the last resort, I have to start getting tickets stuck on people, then that's it. But yeah, I'll take that away. Chat.
And let us know, we'll try and.
Yeah, of course, yeah, no.
That's great. Sorry, can we
One
not
final-
have sort of separate conversations
Just one
going on?
final
I'm just aware of time as well. Is it a burning
Second
issue?
thing is AD's doing brilliant work, and we discussed this at the parish council, but we discussed it. But AD's doing brilliant work in the 20-mile-an-hour zones and stuff. But the approaches to the village is where really you can have impact, because catching people, quite frankly, at 24 miles an hour, great, brilliant, etc. And he always picks the place where he catches loads of people downstairs. Yeah, great. But what the villagers and the parish council are saying, yeah, and I've had it, you know, you come along Aaron's Green at 50 miles an hour and people are overtaking you and going into the village. So can he not? I
Here
think
it's a 40 now, isn't it? So
Pardon?
let's not go 50 and a 40.
No,
It's 40 now.
It's definitely a 40.
It's 50.
We're in Heritsbridge and Herons Green, isn't there?
But point being,
Yeah.
I did send an email following that meeting because you said send an email, but I've had no response.
No, I've gone back to AD, obviously, so from the last meeting, I've obviously been liaising about High Littleton, because High Littleton has a very long 20-mile-an-hour zone. I know that's not relevant to specifically here, but I know that's another thing AD's got. Compton Martin, was it? Supposed to be Compton Martin Beach today.
Yes, please.
So Compton Martin, I know AD is slowly but surely building up in the follow up from the TRO, isn't he? Because you've got the TRO in place, then he has to do the, what's it called, the covert box. What's that box called, Mark? I know it's a C something something. It's like a covert speed detection. That's it, CSD, covert speed detection. So he has to do that to make sure. I get what you're saying about catching people outside coming in, but people also, it's a tough one because I can't speak for the road traffic department. With, you know, did we get apologies from anyone? But we didn't, did we? But yeah, no pains. I can feed it back to him about the outsides coming in. Are we talking predominantly coming along the 368 from Bishop Sutton? So outside Chelwood towards Bishop Sutton, that's one of them I know. Where
That's
else are
not
we
what
looking?
I'm talking about Aaron's Green across and into the village there.
What, going the Bishop Sutton direction or the Hartree direction?
Hartree.
Hartree. So
I
okay.
think it's a problem approaching
I'll
quite
have a chat with them about the approaches.
Can I just
I know.
sort of, because we've got somebody
I-
waiting for quite a long presentation. We really, really
No, no, it's all
appreciate
right.
all that you do.
You all know you can get hold of me anytime,
Yeah.
anyway. You can all contact me. I think my mobile number, my email. Me and Martin got a flight tonight. We're on our
That's
day
fine.
off actually, so.
Well, thank you again for coming.
When's the next meeting?
Much appreciated.
In February on the 11th.
February the 11th.
That's coming,
Okay,
yeah.
so I'll be here again. So as you all know, I'm coming, whether it's my day off or not, I will be at these meetings.
That's great.
But yeah, just chase me. Anything you need, chase me. You know, I want to be held accountable. Sometimes I don't, but.
We really do appreciate
No,
it.
you're all right.
So thank you.
Thank
Thanks.
you.
And I think some of the issues about speeding into villages, we can pick up on the Teams meeting with you, can't we? Yeah, so, yeah, that's fantastic. Thank you both. Bye, bye. Okay, right. So now we're moving on to what is the main theme of our meeting tonight. Our first speaker is Amanda Davis, who is from Head of Transformation of Community Health Services for HCRG and BEMS.
Hello, can you all hear me okay?
Yeah.
Yeah, we can.
Perfect. Can you see the screen okay as well? Don't worry if you can't, I will talk through each slide. Thank you for the introduction. My name is Amanda Davis and I'm Deputy Head of Partnership and Engagements within HCRG, and we are a community health organisation, and I'm really delighted to be invited to come and speak to you tonight, and I'm really sorry I can't be there in person. I've got some caring responsibilities as well, which makes it a bit tricky, so I'm really grateful that you've opened up to be online as well. I've got a few slides to just take you through an introduction about community health services, so this won't be the first time that we connect. I can come back another time as well, which should hopefully take no more than about 10 minutes as well. So as I mentioned, we're a community health organisation, and I do have a slide which tells us a little bit more about what that includes, but it's things like physiotherapy, podiatry services, services for children with disabilities, and things like community nursing as well. So that's the type of things I'll be talking about. And back in April, we started delivering community healthcare across our system. So in BEMS and in Chew Valley, we've been working in this area for a number of years now, and we've been newly expanded to work across Wiltshire and Swindon too. So it's a bit of a new journey for us, and I'm going to take you through a little bit of that.
Amanda, could I ask you to
Yes.
put your slide show on so we can see the full screen?
Yes, I
Okay,
just
that's
realised
brilliant.
it wasn't.
Perfect,
Give me
thank
1
you.
second. That's much bigger and better, isn't it? So I'm just going to talk you through this stepped care model, and what you can see at the bottom there is firstly a digital front door, and we know that not everybody is digitally enabled, but for those that are, there will be an opportunity moving forward to have an easy access opportunity to find out more about community health services and the way in which you can access apps about how to, not apps, sorry, little videos about how to look after certain conditions, linked as, for example, physiotherapy and things like that. But it's a digital platform with some really helpful resources aimed to help you find the right support and advice that you might need. And it's also bringing in our key partners, for example, in the voluntary sector as well. So we would see a perfect link in there to our community wellbeing hub, and Sarah's going to talk to you about that, I think, tonight as well, what the community health wellbeing hub is up to at the moment. Now, we do recognise that not everybody is digitally enabled, and there will be a single point of access with some care coordination within that, so you can ring in. At the moment, I mentioned we're working across Bath, North East Somerset, Swindon and Wiltshire, and we've been discovering all the different ways of working, if you like. So, for example, in Wiltshire, we found that there were over 180 different ways or phone lines into community health services. And you imagine how challenging that must be. So bringing in a single point of access will really help with that. So you'll be able to ring up and say, this is what I need. And the role of the care coordinator is to provide support and navigation so that you get the right support from the right people. Then you can see neighbourhood teams. You may be familiar with the NHS 10-year plan that was published very, very recently. And that talks a lot about neighbourhood health. And for us, that means bringing therapists and together. There are lots of different pathways at the moment. So you might have a need around heart health. You might have a need around breathing difficulties. Want to bring those teams better together, closer together, and to have some personalised holistic assessments and care plans. So working in that multidisciplinary team. And in Bath and North East Somerset, we've already been working on some of that really closely with the Community Wellbeing Hub. For example, running a multidisciplinary team around frailty, where our third sector colleagues can bring cases for wider discussion, so we can get the right support at the right time with our community health teams. You can also see higher up again, there's the specialist services, and those specialist services, so for example, if it's children and young people, it might be around let me think of an example, around swallowing, for example, and that specialist ongoing support if you have a health condition. We want to be able to reach into those neighbourhood teams and provide support closer to home. So, for example, another example in adult services might be the bladder and bowel team supporting those neighbourhood teams. Then you can see community hospitals. So there's Poulton Hospital, for example, in Baines, and St Martin's Hospital. And that's about helping people utilise those services at the right time, keeping people out of the acute hospitals when needed, but also the hospital at home team. There are things that we'll be able to do with technology in the future as well, that can keep you at home for longer and safer as well. Just going to move to the next slide. This is just to share with you a little bit about what do we want to get out of this new way of working. So we really want to improve the health and well-being of our local people and our local population. And when we talk about neighbourhood health, local means not just Baines, not just BSW, but local to Chew Valley as well. And we want to increase the overall life expectancy and the impact of long-term conditions, keeping people healthier at home for longer. Improving access to care and improving experience of care is really important. My background is working with the voluntary sector, and particularly my background is working with the homelessness sector and drug and alcohol population as well. I've worked in that space for many, many years, and improving access to care for some of our groups that traditionally find it difficult is a real passion of mine too. But we'll be looking at how we monitor or measure our outcomes based on things like improving access. It's really key for us to have a really great workforce, and I'll tell you a little bit more, and then my next slide will coming up around some of the new staff that's come on board, and making best use of digital technology as well. You know, we've got opportunities in hospital at home, for example, to have equipment to monitor conditions. This is just to give an example of the breadth, really, of community health pathways. And I apologise in some way for the number of acronyms in there. So I'll just run through a few of those for you. So LDAN, that means learning disabilities, autism and neurodivergence. CYP is children and young people. And there are a number of things in the adults there. As you can see, a whole range of things. AOL is end of life care too. We are reviewing these over a phased approach. So the contract is for 7 years, and we are taking a number of these that we're looking at in the first year and some in the second year. But essentially, there's a whole raft of community health care pathways. So how are we transforming services? And I've mentioned to you about that stepped care sort of approach. And we really, really want to help people in that prevention. And it was really great to hear, Alex, you talking about your community first responder approach. Things like that are absolutely key around that early intervention, aren't they? And taking the pressure off the ambulance services. And how we can get that digital front door right is by making sure that we link up with what you're doing in the Community Wellbeing Hub to provide some of that information and signposting through. And in the first six months of this contract, it's been really, really key to understand, certainly from the 1st of April, what our staff bringing a lot of staff together across Baines, Swindon and Wiltshire. We know some areas might be doing some things in different ways, but fundamentally we've transferred across to us approximately 2,500 staff. So this first 6 months, our priorities have been around settling those staff in, feeling supported, and really ensuring that they carry on with the great work that they do. It's been a priority for us that there's been no impact on patients in terms of bringing new staff on board, but as I say, empowering our staff to settle in. Alongside that, you can see in this first 6 months, we wanted to, and you can see it on point number 5, I'm pointing at my screen, can't see me pointing at the screen, but point number 5, which is around creating an identity about what we do rather than HCRG Care Group. And we've been on a process that we started in April. So we've been out listening, we've run some surveys, and we've been developing that. And we're in the process of finalising some of that. So I've got a few asks of you this evening. One is, we still have our survey open, which I really would love it if you went into that, because you can start to see what some of the naming or service identity might look like, and we really value your views. So there is a link at the end of this slide for you to do that. That is an example. So if you click on this link, you'll go into a survey. So for example, this is some mock-ups of what one of the options might look like for some of the branding. So I won't labour on that, but please do go in and take a look. We're really keen to hear your views. And so that's the first 6 months. So moving to the end of year one, which will be the 31st of March 2026. We want to really have got moving with our integrated neighbourhood teams. So for Bath and North East Somerset at the moment, we're really building up that multidisciplinary team approach. We want to, by the 1st of April, have that one phone line in for those that need it, so it's clear and it's not confusing for people. And to have started on that digital front door where you can come in and crucially be able to self-refer into services, which at the moment you'd need to go to your GP if you need an occupational therapist, for example, and we're going to open up the ability to self-refer into services. By the end of year two, we're talking here much more about how, you know, you've seen the slide with all the different care pathways. How do we ensure that you have one single assessment which is embedded across all the different pathways? You don't want to keep telling your story lots of times. You want to make sure that the right people are supporting you and that you feel heard and understood and involved in your care planning. So we want to get that right. And in one of our other areas, and I think it's Wiltshire, we're trialling something called what matters to me type of approach. I've mentioned before about digital, but we're also looking at an estate strategy, and what that means in practice is, where are our great buildings? Where do they work? Do they work in a way that is sustainable, and are they in the right places? So by the end of the year two, there will be a full review of that. You can see VCSFE there. That's an acronym for Voluntary, Community, Social and Faith-Based Enterprises. We work really closely with 3SG in BEMS, and we go to all of those meetings that they have with the wider third sector, and there's over 200 members of 3SG, because we really recognise that we can't do this alone and that we all need to work together in community health. And our VCSC services are an integral partner. Myself and Phil Walters, who's the head of partnership and engagements, we sit on the Community Wellbeing Hub board as well. And I've known Sarah for quite some time as well, which is really, really great to be able to work together. So I have mentioned already about where can you firstly find out more. There's a QR code there that you could scan. We've been doing some engagement with young people around the self-referral process. They told us they loved QR codes. They also told us, I could see you had a police officer earlier, that they really want to see QR codes and things like the police station, for example. So I've popped that on there, but you can also click on a link as well to find out more about what I've just described with community health. There's the survey that I've mentioned, just to find out your views on what we would like to call community health services. And if you want to know more or be involved more, there's the third bullet point where you can click on that, leave us your details, tell us which areas of healthcare you're interested in that we're delivering, and we'll reach out to you. And we have, I've just mentioned it actually with the young people in the barcode, been doing some engagement and co-design as well. We've also got lots of work, and we recognise that we need to work with our local authorities, our hospitals, our GPs, community wellbeing hub in BEMS, and our voluntary and community sector partners. And you've got Phil, who's the head of partnership and engagements, contact details there. So that's it very briefly from me for now. My main thing was to just really say we do want to hear from you, and please do get involved and work really closely with Community Wellbeing Hub. And yeah, thank you for having me.
That's great. Yes, that's great. Thank you very much, Amanda. Is the survey ongoing, or is there a cut-off date on that?
So there's a cut-off date for the branding one, a service identity. So I think that's going to close fairly soon. I'm really keen now for that to in some ways conclude so that we can get our posters done. We can come out, get out to GPs, sharing this information, etc., etc., because we've got a big communications piece to do here, and it's really difficult to do it without our name being in place. And then I can print things off and have leaflets and all of those things. So it's open at the moment. But yeah, I would be really keen for you to complete that as soon as you're able to. But if you'd like me to find out when the closing date is, I can take that away and find that out and communicate that back through Sarah.
That's great. Thank you. Thanks. Can we just take a couple of questions if anybody's got any questions? Alex?
Can I just have a couple? Firstly, what's the referring? How do you refer people to yourselves? Does that have to come?
How do we? So, I think I just heard that right? How do people come into the service?
Yeah.
So right now, today, you generally go through your GP, but we are changing things from the beginning of April, where we want you to be able to self-refer into services. And that's what we've been designing with our engagement, what that looks like, through a digital approach or through that single point of access, so there'll be one for BEMS. So we're hoping, we're talking for Alex, talking about taking the pressure off ambulance services and things like that. And in a similar way, we want to really focus on that prevention approach too.
The second part of it was, do you operate alongside the village agents?
So village agencies are fantastic. So Denise Perrin, I know well, they're a fantastic service, aren't they, in the voluntary sector, and they're a real key partner. And I think what we need to build up, so yes, to answer your question, yes, and they're part of the Community Wellbeing Hub, and they're also a key member of the multidisciplinary team to bring cases to. What we want to join up is through that digital front door. How can we help signpost people through to the voluntary sector? And I think for BEMS, we've got a really special opportunity with our Community Wellbeing Hub to join that up as best we can, and village agents is part of that.
Thank you. Yep.
Yeah. Right. Again, for us as community representatives, if you like, if you're going to hope to start this self-referral from 1st of April next year, I didn't quite catch what's the communication mechanism and rollout process now to kind of make people aware of this.
Yeah, so I think we've got a really big job on our hands to communicate that out, and we do have a communication plan, so we are really committed to communicating it effectively. Things like this help us shape what that might look like, and we really want to use the tools that we have to simplify through that referral form what we want to do. So the first phase, I think, is as soon as we've got our name, that will enable us to trigger to that next stage of our communications plan. So coming through coming through the Community Wellbeing Hub, being out, putting posters and things out in libraries, talking on the radio. There's multiple different ways that we can do this. It's an all-age service, so young people have told us how they would want to access service through our schools. So we've got to keep working on that. We do have that communications plan, but also working with yourselves and the Community Wellbeing Hub to share that information. So it will start to ramp up as we move along.
So just at the moment then, to be clear, there's no specific ask of us in terms of that communication, because we haven't got anything specific to communicate, have we? Yeah.
Nothing, no ask of you just yet. That's right.
But there will be in due course. Thank you. Thanks so much, Amanda.
If you would like to. Thank you.
Get those posters out.
Thank you. I'd be delighted to.
Can we now welcome Chris Lewis, and you're going to do an update about the GP Federation, what's happening in the GP. Do you want to come here? Or
Yeah.
Go there.
It'd be really fun to see. I think I'll stay here because then I can see the screen. If that's it. Thanks very much, everybody. Hi. I was reflecting. I think I did do something during the pandemic online, but it's lovely to see everybody. Well, I'm feeling a little old hat doing. My name's Chris Lewis. I'm a GP partner at Timsbury. But I also, for my sins, because I have nothing better to do with my time, I'm also a director at BEMS, which is the GP Federation. It will say I'm Dan Smith, but I promise I'm not. Do you want to go to the first one, Mark? So, just by show of hands, there we go. Is anybody not registered with a practice in BEMS? Is anybody registered with a practice in Bristol or North Somerset? Then I'm really sorry, quite a lot of this won't apply to you. I work in 2 surgeries. You work in 2 surgeries, okay, so you know a bit about it. And apart from Amanda just mentioning it, did anybody know that there was this year a 10-year NHS plan? No, you did. Has anybody read it? I'm so sorry, you're not getting that time back. I will try and summarise it for you so you don't have to do it yourself. And the final thing is, as Amanda did say, we talk in a lot of 3 and 4 letter acronyms. I will try and catch myself. If I mention something, if you see something on screen, you don't know what it is, please stop me, because we do a lot of that. So BEMS, there's the first 4 letter acronym. BEMS Enhanced Medical Services is what's known as a GP federation, and we are a not-for-profit organisation. So what that means is where we do make money by running commission clinical services. Where we make money, we cover our running expenses. If there's anything that goes over, it is recycled back into the NHS, recycled back into our member practices and the primary care networks, PCNs. I might mention that one occasionally. How do we do that? We do it through training, through providing services for them, for education, that kind of stuff. Aims and objectives. Delivering services directly to patients registered with our member practices. So terribly sorry, Bristol, you can't have these services. It's for our member practices. We deliver a number of clinical services. We'll go into those a little bit and I'll talk a bit about those. 2 and 3, I think, sort of come together. We deliver services and functions to support our member practices, and we develop the primary care workforce. So that might be through education. It might just be through a forum like this, bringing together practice nurses to come together, share good practice. Final thing is representation of the voice of general practice. The difficulty with being 20 different separate organisations is who do you go to? So what we do is we're a sort of, we come together, and if Sarah wants to come to talk to us about the Wellbeing Hub, you come to BEMS and we have that conversation. So one of the things, I think one of the most important things that BEMS does is actually we're quite good at interfacing. So we talk to RUH, we talk to HCRG, we talk to the council. I had a meeting with Will today. We talk to third sector organisations, meeting with Age UK the other week. We talked to Curo. Anybody who thinks that we might have something to offer, some sort of input that we can have to try and help with the health of the community, to help our patients, we will try and often be that group that people come to talk about general practice in BEMS altogether. Thanks. I think you know what BEMS looks like. I mean, I suppose the only thing I'd say throughout here is the concentration of practices in Bath and the concentration of practices in Cambridgeshire, and then look, all the practices around here are all very spread out. So one of the issues we've got in this particular area is just our rurality, and the geography really doesn't help us very much. What you can see here, the little different coloured flags, are the primary care networks. So Bath is a little bit of a mishmash, Cambridgeshire with its own thing, and everything outside of Bath is Three Valleys primary care network. That's where we all are. Okay, thanks, John. So these are the 3 sort of pillars that we think about when we're talking about what we do. We run our clinical services. We have a pillar which is looking after primary care workforce and education. And then this third one, which I think is really vital, which is about working in partnership and collaborating with others. And one of my particular interests is how we liaise with secondary care. So what is that interface between your GP and the hospital, particularly RUH? and what sort of opportunities are emerging in between those two things. So here are some of the services we run. DVT, deep vein thrombosis. We run a community service for that. So your GP, you think you've got a swollen leg, you go to your GP and veins can do a little near patient test. If you've got a positive test, you can have your scan. We run clinics 2 or 3 times a week. Don't have to go to hospital for that scan. Enhanced access. So this is something that the primary care networks are charged with doing. Some of them don't want to provide that themselves, so they purchase that service from BEMS. And this is clinics in the evening and at weekends with nurses and doctors. Sometimes they're face-to-face, sometimes they're telephone. Getting on for 30,000 patients last year. I'm a bit worried about this rash. Really bad acne. So we run a community dermatology service. Secondary care dermatology clinics are really stretched at the moment, and they're really mostly seeing things that could be skin cancer, which leaves everything else that isn't skin cancer waiting a very long time. So we have for many years run a community dermatology service. That's with GPs with an extended role. GPs have done some extra training in dermatology. Often some dermatology surgery as well. And we also have a nurse that runs a clinic for some particularly powerful, very effective, but slightly nasty drugs that can treat really, really difficult acne. So that's that service. UTC, Urgent Treatment Centre. This is a GP service that's housed within A&E at RUH. So if you rock up to A&E with a problem that is really a general practice kind of problem, you will see either a nurse or a GP there. Fracture and soft tissue. So again, this runs alongside the orthopedic services at RUH. We do, so if you go and see, I've sprained my ankle, your GP can send you to our clinic if it's within the first month of having done it, and we might see you there. Holt and MRU, big users of this service. You know, they often will send people into this rather than up to RUH. PUSH, Pediatric Urgent Service Hub. Well, the more common name for it at the moment is an ARI hub, an acute respiratory illness hub. So this is something that runs through the winter months, just started recently. This is for children who are acutely unwell, mostly with respiratory illness, but basically, you know, if your kid's got a fever and you phone up your GP, if you haven't got an appointment, we've got some extra capacity to help support general practice, look after those kids who need to be seen the same day. CMDU, COVID Medicines Delivery Unit. So if you're a particularly vulnerable person, you pick up COVID, you can have antiviral medicines. It's quite a specific service this. So actually 659 patients, that's across Baines and Wiltshire and Swindon. So for any given practice, that might only be 3 patients a year, maybe. So what we have, it's not really good for GPs. We don't have enough speciality in that particular prescribing. So to cover the whole of the area, BEMS provides a service to provide those antiviral medicines for that particularly vulnerable group of patients. Thank you. I'm the Quality and Clinical Governance Director. So this is the bit that warms my heart when I look at the patient feedback that we get and the comments that we get. Amazingly good feedback for the health service. So really pleased, and such lovely comments. We've got a really dedicated team. We take quite a lot of pride in how we deal with patients right from the point of when we get the referral all the way through. So question at the back.
Yeah,
2 questions at the back.
one question. Can I make a comment about feedback?
Please do.
Which is really sad, actually. Feedback is notoriously hard to capture.
Yeah.
And I work in healthcare, so I know that's very challenging.
Yeah.
But also, I have been one of your patients in your dermatology, and I must say your capturing of feedback is excellent.
Thank you.
So the actual doing the feedback and
Yeah.
complementing the capture of the feedback, not just the capture,
No.
not just the feedback of
Yeah.
the service,
Yeah.
but feedback is notoriously hard. Yeah.
It's really hard, and I
So,
think
well done. You did test us.
there is good.
That was good. Well,
I'm glad and sorry. I think it's a little bit like the Trustpilot thing. You know, that if you've had an exceptionally good or exceptionally bad service, you're more likely to leave something. If it was, yeah, kind of okay, kind of what I expected, you tend to kind of blow past it. But so I think that probably is that we do really try to give patients a good service. And I think because I think we do give them a good service, we're more likely to get the feedback. But you're right, we do have fairly robust mechanisms for trying to get it. So.
Thank you for your presentation. Do you have any representation to the Health and Wellbeing Board?
Yes. So glad you mentioned that. I'm going to come on to that, if that's okay. So move on. Okay. These are a couple of other things we do. We do a bit of work around health inequalities. So these are particularly hard to reach groups. So things like we go out to the boating community, often aren't registered with a GP because they're a little bit more itinerant. So we try and do some health awareness stuff with them. Patients with learning difficulties, we try and do some smoking cessation stuff. The other thing I'm particularly working with is the cancer care work. So there's a group called SWAG, Southwest Action Group, who have a particular cancer focus. One of the things we've been doing with RUH is trying to make sure that when somebody's completed their cancer treatment, the discharge summary has a really good summary, a really sort of standardized treatment summary, different for every speciality, different for different cancer types. So we've been doing some work around that. The other thing we're trying to do, and this has really come out of my work in general practice, I'm very aware when I go around that there are certain places on my patch that I always seem to be visiting for end of life care. And I'm very interested about trying to plot that on a map and say, are there particular hotspots for different types of cancer around the BEMS area? So we're working with RUH cancer teams to try and bring the data set from primary care and the data set from secondary care together and go, where are we seeing hotspots of pancreatic cancer? Where are we seeing places where they're not being picked up early, they're being picked up late? And can we use that then to try and target prevention strategies going forward? So I think that's quite interesting. So there we go. Thanks, Mark. Okay, workforce and education. We do some training, we run nurse conferences, we do all sorts of things just to try and upskill our workforce. Let's move on from that. Okay. So, gentleman at the back, well, who do we represent? Well, we go to lots of different things. The first column is stuff in BEMS. The first stuff is across BEMS, Swindon and Wiltshire, and then who we meet with. So there are all sorts of things. I'm not going to go into, I mean, you can ask me about any of those groups if you want, but it's just to show you the breadth. And certainly our chief exec, who's Dr. Charles Bleakley, who is a locum doctor, but you might have met him because he does some work at Kew sometimes. So he goes to a lot of these meetings and he sits on, alongside HCRG and other colleagues, he is a permanent representative on the Health and Wellbeing Board. So I think we are keen that primary care is a part of these conversations that, you know, we know. I mean, I'm just looking at the BMA modesty. I think the last data I saw was for September, and in September, England GP provided 16.4 million GP appointments. So we are a big part, with a bulk of what happens in the health service. I think we tend to focus on the hospital because it's kind of big, sexy stuff. But actually, the majority of what happens in the health service is actually in primary care. So we want to make sure that we're part of those conversations, really to facilitate and say, how do we work together with colleagues to make sure that patient journeys are streamlined, that the quality of care is as good as it possibly can. Information sharing is good because that's vital. If you've been in hospital, come out of hospital, how do we make sure that everything's understood and we're doing everything right? So I think for us, like I said, this sort of interfacing is really important about how we work with our colleagues to make sure that patient journeys are as good and as safe and as streamlined as they can possibly be. Understanding we're working in a system that's pretty stretched at the moment. Does that answer your question?
Yes.
Thank you. Okay. Practice support. So again, we are a membership organisation, and so as well as looking after patients, we want to look after our practice because, trust me, they're having a tough time at the moment. So we try to provide support for them. So we run surveys for them. If they haven't got time to do that themselves, we look at staff welfare. Freedom to speak up guardian. I am the freedom to speak up guardian. This means if there's a problem within a practice, that we encourage people to raise it locally, but if they feel that it can't, they can come to one of the three of us and we can raise it on their behalf so that they feel that their concerns are being listened to and acted upon. We have project managers, and we have practice managers working with us. If a practice is struggling, needs a little bit of support, we can second somebody to them on a temporary basis to give them some extra support. We work on our IT systems to try and support people there. We moved offices, we downsized, and we gave out whatever spare equipment we had, or tables or desks and things, we could share that with our members. Let's move on from that. Okay, so what are we doing right now? Outreach vaccinations. So one of the things that BEMS did in the pandemic was to support practices, particularly in the centre of Bath, with vaccinations. Many of you may have been out to the Soma Centre and Medicine and Norton for your COVID vaccines, possibly. No? Okay. Bath didn't do it that way. They asked BEMS to organise it, so we ran a service out of the pavilion, often with a lot of council staff, actually. Thank you very much. So we've got a bit of experience in doing vaccinations, and what we are doing across the whole of BEMS, Swindon and Wiltshire at the moment is doing vaccinations, flu and COVID, for housebound patients and nursing home patients. Again, somebody needs to do it, so that's quite stretched, so this is a service that we can offer. We're going out to all our member practices at the moment to ask what their thoughts about BEMS are, what they'd like us to do more of, what they know about us, trying to explain what we do. Image taking hubs. This is another dermatology thing. A lot of skin cancers are diagnosed by photographs. Photographs we can get with our phones and our kit in the surgery is not really good enough. So what we've done is set up some hubs around, there's some in Chew, there's Elm Hayes, there's Hope House, there's some in Bath, to try and make really good photographs for the dermatologist, so that if there is, they can have a look at that and say, yes, we're suspicious about cancer. And we're doing more cancer awareness work as well. What we want to do, so this is the 10-year plan bit, and I will summarize it down to 3 things. Analog to digital, moving care out of hospitals and into community, what's called in the trade left shift. I'm not quite sure why we're on the left, but there we go. And sickness to prevention, so focusing much more on preventative work. Now, if I was going to be cynical with you, having been in general practice for 22 years, these have been priorities for quite a long time. So there's nothing new under the sun, and these things are not brand new. Analog to digital sounds quite sexy, but actually it's how those systems work together, and we're not always very good at that. Hospital systems and primary care systems don't talk to each other very much. You could help by having things like the NHS app on your phone. I don't know how many people have got that. A lot of staff is going to start moving over onto that app. So if you haven't got it already, consider doing that. Hospital appointments are going to start moving onto that. More stuff from your practice is going to start moving onto that. So that's something that you could help with. Hospital to community, I think this is a real opportunity. And certainly what we in BEMS are thinking about doing is having these intermediate services, a little bit like our community dermatology service. If you don't need to go to the hospital to see a consultant or a particular bit of kit or a particular treatment, is it something we can deliver closer to home for you? And that's something that we're working with the IUH on a lot. Been working on that for about 5 years. The difficulty has been the contracts and the funding, but there does seem to be movement from government about actually allowing that to happen. So we ran a pilot scheme for a women's health hub in gynecology recently. Haven't been able to carry that on because the pilot money ran out, but we're really hopeful that that's something that we could do. Fantastic feedback from women who were having to wait nearly a year to see someone in the hospital. We could see them in 3 weeks. We've had people in tears on the phone. So there's a real opportunity to develop that, and I'm quite excited about that, and I think there's some really good work we can do there. Sickness to prevention, again, really important work. The trouble is people will insist on getting ill, and it's really hard not to pay for that. So vital work, you know, we'd love to do some stuff. There's some obesity strategy coming through. There are things in there, but it's quite difficult. So intermediate care, we want to develop these community services. We're thinking about ENT, we're thinking about gynecology, we're thinking about gastroenterology. Basically, everything's on the table as far as I'm concerned. And the IUH are starting to become more interested in this work. And then the other thing is we've been very BEMS focused. what we recognise is that we now work in a much bigger area with Swindon and Wiltshire, and that is going to get even bigger with Somerset and Dorset. So we want to start looking about how do we spread some of our services a little bit wider, probably in the first instance within an RUH kind of footprint, because that seems to make sense to focus ourselves around one hospital, but we could go wider if we need to. Thank you. Okay, that's the end of the presentation. Two other things can I mention, because I've got a pulpit. Number one, back on the prevention thing, flu. Flu is going to be bad this winter. There has been a mutation. We are, according to the NHS figures, about 5 weeks in advance of where we normally are for the winter. So it's starting to hit. If you are entitled to a flu jab, strongly recommend you get it. They're saying possibly the worst flu thing for a decade. So let me encourage you, if you haven't had your flu jab, go and get it. Second thing is, and I'm speaking to parish councils here, local plans. We all recognise the housing pressure. And a lot of practices are quite nervous about how we are going to cope with more houses and more residents and more patients. So I'm in Timsbury, we haven't got the biggest development, but we are already at capacity. We are already under providing for the community we have right now. If we are going to get 300, 400, 500, 600 more houses, times 3, that's how many more patients. We are going to struggle, and we are on the limit of our footprint. Chew, I know there's a big development in Whitchurch coming up, so I've not spoken to them, but I think they are also nervous. I know the consultation has finished, but if you have opportunity to press council about the infrastructure that goes around those, please don't forget general practice, because we are nervous about it. And I know, you know, our councillors, lovely councillors, lovely press have been great. But let me please encourage you just to keep that in the forefront of your minds, because it's bad enough. We know it's bad enough getting an appointment right now. If we build all these houses, it's only going to get worse. And we do need to think about how we support our premises. I think there's an opportunity for all those things we've talked about. The shift of services out into the community will need somewhere to work out of. The integrated neighbourhood teams that Amanda sort of alluded to, they are going to need a base. So there is a good reason to have a bit more estate around, a bit more physical space. But as parish councillors, please push it. It's something that we're nervous about. I think it's something that our communities are going to need. So please think about it when you're having your discussions with them.
Thank you very much, Chris.
Pleasure.
Really helpful.
A question at the back.
I did use your imaging service for something on my head only a few weeks ago, and it was absolutely excellent. From
Delighted.
start to finish, with a
Terrific.
couple of weeks, really good.
Terrific. I mean, that's quite a new one for us, so that's great. I'm really glad. I'm sorry you had to use it. Thank you for using it. Thank you for the feedback. I will pass that on.
Anna.
I have questions about the 10-year plan.
Yeah.
First
Oh,
one is
great.
around
Terrific. Thanks for that.
I know it's difficult, so a lot of our patients in my service are quite critical of getting GP appointments. That one.
No, really can't imagine that.
Now gone onto the digital triage system with clinical review. That would be a big change for a lot of people. Some people don't like it, but I think overall that's probably a good decision.
Do you want to talk about it? Okay, yeah. So I think, I mean, back to that sort of digital divide thing, I think it does favour people on the digital side of the digital divide. Certainly speaking for my practice, we've got quite an elderly population who don't always have access to a phone, an iPad, a computer, don't have broadband. So we're always very conscious. I think particularly in my practice, I think we're quite nervous about it. But it is definitely the way things are going, and we cannot see a way of not doing it.
Right.
I think one thing we are quite keen to get right is, and we probably won't off the bat, but we'll iterate as we go, is about getting the proportion of people who do need to be seen on the same day, people who need to be seen that week, and people who really it can wait a month. And trying to get that balance, I think, is absolutely critical. So I spent 2 days doing number crunching on months and months of appointment, going through about 300 appointments, going, did you really need to be seen? Could it have waited a little bit? Could it have waited a little bit longer? So it is, I think it is a movement towards that, and for us, that's probably something we're going to do in the new year.
But then you can share that and replicate that.
We're quite late off the blocks, so I
Okay,
think
yeah.
we've taken a lot of learning from other practices.
My other suggestion, when you talk about music, I'm just gonna tweak the whole impoverishing equality health
Yeah.
and say spirometry in the community, COPD diagnosis, fake COPD. Because it's just the big thing with poverty.
Mhm.
So I'm gonna shout that one out there. And then the final, what's the final one?
It was in your head.
It was in my head.
Yeah.
What's the last
So-
one, the NHS plan?
Yeah.
Prescribe exercise. I'm a physiotherapist. Prescribe exercise. You've got an obesity crisis, prescribe exercise.
Yeah.
There we go. Let's get rehab classes for everyone.
That's great. Yeah, so there are sorry, I'm way over time here. You're right. First contact physios are something that the primary care networks can employ. There are not many of them.
There's about 7.
We'd love to have more. We had a meeting with one last week who's set up a website for mere GPs, because we don't know about Exeter. And to say, oh, look, it looks like we think you've got a meniscal tear in your knee. This is the exercise package you need. So that's really helpful. I agree. I'd love to have people doing Tai Chi on the, in the parks, because I think the evidence for this stuff is fantastically good. Great for your balance, great for your concentration, great for your dementia, builds your strength up. Anybody can do it.
We do have in Shoe Valley, we do have a Tai Chi class.
Right.
We do,
I love
with the Chew Chat
Yeah.
for the elderly.
Yeah.
So I can highly
Yeah.
recommend it
Yeah.
because it is fantastic.
I'd love to have them across the patch, but I think that's the thing, isn't it? And that's the preventative bit, is how do we make that a sexy thing to fund?
It's got lots of the NHS, isn't it?
Can I just come in there? The thing we're going to ask you to do in the end is to write down activities that are happening in your area. What we'd like to do is to get a whole list about what activities are going on where and try and build on that so that people do know where to go and are encouraged to go to those activities.
You're doing a thing called the Hope Directory,
They did.
and the Hope Directory had about that much for Bath and about that much for outside of Bath. So it'd be really good
Do
to
that.
build that up, and it could be the minute you
An
publish
ongoing-
anything, it's out of date. But if it's something that could be a website and could be curated and kept up to date, that would be
That would be great.
Can I make just one point about what you've just said?
Sure.
Bristol are bringing in a charge of £250 for anybody wanting to use the park for things like Tai Chi and other things.
I think they're going to scrap it.
Yeah, I think.
Well,
it was too.
Yeah, scrapping it.
Well, they haven't said they're going to, it was said they were going to.
I'm going to
Charging for parks is outside of my remit.
I realise that, I'm just making the point of the lack of because
Very quick question, because we're desperate on time.
And you're saying that, that whole thing about trying to work out like when people need appointments. As somebody who's had to visit doctors sometimes recently, I've needed like regular 3-month checkups. It becomes up to me to book that appointment, and trying to book that is quite challenging. So I think, is there a piece of work around where someone's got to go every year, 3 months, 6 months, whatever, they actually get like a text or something? Because that doesn't happen to me. I have to basically remember, and then it usually ends up being 4 months because I can't get an appointment. And rightly so, I'm not ill, but it's just that thing if I need that. So I think it's that thing of my vet will send me a text. Yeah, I don't get that. That seems a bit odd.
What you're talking about is the recall system. I can give you 5 hours on recall systems, but not now. Sorry, Sarah.
Sorry.
No, that's all right.
Sarah, we were going to ask you to do a quick update
I
on.
can. Yes.
Yeah.
There's so much I could say that Chris has said that actually the preventative offer can help deliver and support not only obviously the secondary, but primary care as well. But I wanted to talk, no, you say that's fine. I just wanted to talk to you about the Community Wellbeing Hub, and hopefully most of you are aware of the Community Wellbeing Hub. It's been in existence for the last 5 years, but also I wanted to talk to you about some other offers in terms of the preventative offer across BEMS. So I wanted to refer to the Live Well and the Wellbeing courses. So we just talked about Tai Chi, and we're really delighted about the Wellbeing courses, and I want to
just focus on that in a minute. But just if you aren't aware of that community wellbeing hub, do you mind going to the next slide, Mark, if that's okay? And if you are, this is just a bit of an update about the community wellbeing hub. The hub was set up in March 2020 as a COVID response, originally only for about 6 to 12 weeks. We're still here, and now we have about 38 partners, so we're really delighted, and we're really delighted that BEMS have actually joined the partnership as well, and that's been really crucial so that we can do some more work with primary care and improve some of those referral accesses, working with the social prescribers in the GP practices and making sure that people get that sort of preventative support before they have to go to the GP. So we're trying to sort of make some improvements. We've been working with the RUH and the community hospitals for a number of years now, and we created a digital referral process to support hospital discharge, and that's been operational for the last 2 years. Actually, nearly 3 years now. And actually, we were digital before the RUH became fully digital. So we're quite proud of that. That actually, from a third sector perspective, we were trying to improve some of the referral processes. What we're trying to do, so the hub isn't an organisation, it's a partnership. It's commissioned and contracted partners or statutory services that come together to support health and wellbeing. They all have a contract, and they all agree to a shared vision, which is putting the person at the centre and supporting a person's health and wellbeing. And part of that is working collaboratively, working differently. So go back 5 years, beyond that, we worked very much in isolation. So partnered organisations would do their own thing and their services and probably make some signposting, but not actively referring on to other organisations. What we ask partners to do is really be much more proactive, work together to support a person's care. And so we have enabled our partnership to expand. So we've got 38 partners across all of those sort of themes. So anything from supporting people home from hospital, so those discharge dependent services. So that could be supporting someone with shopping, or light domestics when they return home, they need a little bit of support, to decluttering someone's home if they've been identified, to supporting people around their benefits, as well as supporting physical activity and social prescribing. So we're constantly building and developing the programme and the partnership to support that preventative offer. And I think Amanda mentioned our frailty project. We've done an amazing piece of work with HCRG and the RUH and some of our third sector partners, the village agents and others, to look at supporting frailty in a very different way. So supporting people that are at risk of that sort of high level of frailty, and how can we support them to manage their conditions at home better. And part of that is working with a clinical nurse, as well as our third sector partners working together, doing shared appointments and supporting people around their sort of health and wellbeing, as well as obviously the clinical side of the support. Do you mind moving on to the next slide? So making a referral, what we've tried to do is look at, I'm getting an expert on referral forms, Chris knows really well. It's a bit of a bane of my life, referral forms. But what we've done is created a referral form for professionals. So majority of our referrals, and we have about 850 referrals into the hub a month. We had about 11,000 referrals across the last year. And we supported in the last year about 5,000 people with support. We know that people on average present with multiple different needs, so they don't just present with one issue. There's lots of other things going on around the person. So what we've tried to do is create this multiple referral form that enables you to connect to services, multiple services in one contact. So people say, we don't want to keep telling the story, so it's tell your story once to us and we'll connect you to those services. We've retained our triage central telephone service, so if people want to contact us by telephone, they can contact us. But we're also, as I said, we've got a referral process in the hospitals, and we've got a team of people that work in the RUH and the community hospitals, and they work really closely with the ward staff and patients. And we're also doing some work with primary care to make sure that the primary care teams are supported to make referrals out into the community. Do you mind? I think next. So what I wanted to say is to support that sort of preventative offer in terms of the commission services. And I have to say, we're really lucky in BEMS. We have got an amazing commission services and health offer, health and wellbeing offer. When we've been doing some work with HCRG around their community transformation, we're meeting colleagues from Wiltshire and Swindon. They don't have anything equivalent, so they're finding it really difficult to connect a lot of these services together. So we're really ahead of that transformation, really, in terms of bringing those health and wellbeing services together. But part of that offer is our Live Well directory. So we have a Live Well directory, which is that wider offer. So it's not just those commission services, but it's a wealth of resource and information about small groups and activities. It's about advice and information, and that's an amazing resource. And if you have got a website or you have newsletters, please do promote that Live Well resource, because it's a fantastic resource that people need to access. And then, thanks, Mark. And then also the wellbeing courses. So Tai Chi is great that you picked up that. So one of the things that we, the Community Wellbeing Hub, picked up back in the beginning of this year, unfortunately, funding for the wellbeing courses, which came under HCRG before April, the funding was withdrawn. And we as a partnership felt it was really important that actually in terms of the preventive offer, this was really important. So wellbeing courses could be about people accessing digital, helping with their digital connections. So it could be learning about their mobile phones, right through to Tai Chi, to helping people around anxiety and stress. And so we felt it was really important that we had to get some funding to continue this. So we secured some funding at the just after April to enable us to have 1 year to trial a new way of operating. So the wellbeing courses, we're creating another platform. So this is the platform of courses. We're trying to create this as a space where all activity happens. So come to the wellbeing courses. We can promote partner organisations' activities, as well as we can target some support and activity. So we'll be looking at some areas of geographical focus, as well as supporting people around their mental health, around some health conditions. And so we'll be putting on some targeted courses to support that. And also some of the courses we've trialled, and we were a bit nervous about it, but we trialled some paid for courses. They're still subsidised. And actually that's been going really well. So the subsidy is about £4 a course. So we've kept the costs really low. And we're really pleased with that. And what we want to do is try and link up as much as possible with primary care and social prescribers, as well as the hospitals as well. So we're trying to sort of build that. But we really want some more information locally about what else is out there or where the gaps are. So we're really keen to hear more from yourselves about what we can do more of. And then I think the next slide is just the partners. So these are the partners that have joined the partnership now. And then I've got a final slide, which isn't my slide, but we were hoping to invite the social prescriber from the Hartrees surgery. She is called Lisa Smith. I don't know if anybody knows Lisa, but Lisa has done some amazing social prescribing within the activities, actually, within the surgery. Actually taking the paddock. Does anybody know the Hartrees? So she has now developed the paddock. So she's working with about 20 patients to develop the paddock into a wellbeing space. And she's seen a remarkable difference in the patients that she's been supporting. So they come and have appointments with her, but she's been using the paddock as a space to hold appointments, do activity. And I just wanted to share it because I thought it was an amazing piece of work, that using an underutilized space in a very easy, a very creative way. And she's got a men's shed now. She's got a space for having appointments. She wants to do more. And I've got some information here I'd like to share with you about what she said. And she apologized she couldn't be here. But she said, I currently have a group of 20 patients who come to the paddock at least once a week. This group has been really instrumental in helping me put the paddock and its ideas together. The group are diverse, and it's great to see many patients teaching each other new skills, example, how to use tools. Many patients struggle with physical ability, but I've always ensured that they still come and still share the time together. in nature. We've spent some lovely time sitting and observing nature, and we're really lucky to have it. We've seen red kites displaying themselves, and this has really sparked great interest and discussion. Toads have moved in too, and I think we can see a picture there. Patients are really keen on working on natural habitats as part of our next plans projects, and they've been doing some planting as well. I understand some more trees for BEMS. I think they've been working with them. She also goes on to say there's quite a lot, and I will share all of her sort of descriptions in the follow-up, but she does say that she's supporting the doctors who are seeing a big difference in their patients because of this space, because they feel they can come to the doctor's surgery, but they don't have to go in for an appointment. So they go to the paddock for activity and connection, which is fantastic. And she says that, and there's a quote above here, which you probably can't read, but it says, "I regularly use a paddock to do my consultations with patients, and this has had a great effect. For example, a patient who suffered a recent and sudden bereavement found the peace and time in the paddock really beneficial. They've asked to be outside again for our next few appointments." So we wanted to share that because one of the things we want to do is connect to some of these very localized projects and support them. So hopefully Lisa might be able to come to a future meeting. She's really keen to get support in the community, connect to some of the work that we're doing in the Community Wellbeing Hub, but funding for these types of things is very small and limited, and so she's really keen to get some funding to support some of these ongoing activities that are really benefiting patients, and she can extend that further. So so that was the last slide. So it's not my slide, but they're doing great work, and I just thought it was really worth sharing what they're doing in the Harp Trees. So thank you.
That's great. Thank you very much, Sarah. Lydia and I are just aware of the time. Yeah, so we're just going to dive straight into the annual general meeting, which I promise you won't take 15 minutes. So just to say, this is the forum's annual general meeting. We're pleased to stand again in terms of our respective roles, but equally pleased if somebody else would like to, so that's fine. Lynn and I do meet regularly with other chairs of the various community forums and link across with BEMS officers and the voluntary sector. So this is a final call for any nominations for the role of chair or vice chair. Have there been on this one?
No,
Okay.
unless there is now.
I think we previously circulated the notes of the AGM. Are we happy to agree those as a true record? Yep, fine. And the AGM report for this forum was also circulated. And most importantly, I mean, we do really appreciate people turning up and engaging with the forum. So thank you to everybody. I'll hand over to you now, Sarah.
Yeah, this is just the formal bit. And firstly, I'd like to thank you both for your support. You know, you've been an amazing chair and vice chair, and you've helped sort of direct us in terms of what you want on the agenda. So I really appreciate your support in this last year. So thank you very much. This is only formality, really. Just to say, we have, unless anybody has a burning desire to stand as chair and vice chair, if it's okay with you, we've got obviously Lynn and Heather are happy to stand again. Are we all happy to accept that as an ongoing for the next year for their appointments? Yeah, that's all thumbs up. That's lovely. Thank you very much.
Okay.
And I thank you both for what you do.
Yeah.
I find these meetings to be some of the most interesting and informative ones I attend, and I really appreciate it.
Nice. Thank you so much. Thank you.
Thank you to do it.
Yeah.
I'd like to add to that. I go to like 2, sometimes 3 of these, and this is by far my favourite one, and most important as well.
Thank you. That's really kind.
Don't minute that, don't minute that.
And finally, can I thank Mark and of course Sarah for doing all the support, which means that we can actually all be here tonight and all this technical stuff. The proposed meeting dates for 2026. Next one is February the 11th. It's 6 o'clock. I don't think we're clear at the moment whether that will be a hybrid or not. So watch the spaces, it might.
Yeah, if this all works out well, then we will publicise it as hybrid, and we'll still invite people to come along here. We've got the room booked here for 2026 meetings, so that will be
That's
fine.
great.
And if anyone wants any hard copies of those documents, there's some on the table at the back.
Fantastic, thank you. Can I also just say, can we express our thanks to Alison, who previously was supporting us?
Yes.
So, yeah, so thank you all. I'm sorry we've overrun, but it's been a jolly interesting evening. I really would like to thank all our speakers again. Just so much going on. And I know Lynn's very disappointed that we can't do the exercise.
Perhaps what we
I
could,
think you all need to go home.
perhaps we could bring that to another agenda, maybe.
Yeah, we
Yeah.
can.
Got the idea of just send your, you know, the village you're in and what activities are going on. Can we send them to you, Mark?
Absolutely, yeah. I mean, by all means, send them through. I bring it all together, yeah. So I'll do a little follow-up. I will, yeah.
Fantastic, thank you, Mark. So anything to Mark in terms of activities going on or activities you think should be going on? Would be great, thank you.
Or couldn't or shouldn't.
Well, thanks, everybody, thank you.